my name is Faith, and this is my NG tube video. I have a knock on the patient's door, perform hand hygiene and patient hygiene. Hello, my name is Faith. I'm a student nurse at SEMA, and I'm just going to be giving you an NG tube today. Can I please have your first and last name and date of birth? And I'm going to check that on your wristband just to make sure that's accurate. I'm going to put your bed at working height for me, so it's easier for me to assist you today. I could also do patient teaching as I'm raising the bed, and let them know that if they can help in any way with holding the little pan that they can, and also if they can take things by mouth, I would supply them with a cup of water and tell them that they're going to feel a little bit of discomfort and coughing, but when that happens, they can start taking drinks of water. So if they can, while I'm doing this, I'm educating them on that. I'm going to put them in high fowlers so they don't choke or aspirate. Then I can put this side down just for easier access for me. Alright, now that I've performed hand hygiene, I'm going to put on my gloves. I'm going to also make sure that I have all the supplies that I need. I have the stomach tube, I have the syringe, lube, and tape, and then I also have this, which would be at their bedside table. So I'm going to put on my gloves, and then I'm also going to prepare my tape before I measure out the tubing. Oops. Get a little worn. Okay. So I'm going to at least have 3 pieces of tape to mark the length of the NG tube. Oops. And then I'm going to turn one pair into like little pants to secure it to their nose. And then one to secure it to the gown. All right. So now I'm going to take my pen light and I'm just gonna check into their nares and see which one looks better to use and that there's no blockage or anything. So today I'm gonna be using their right nostril. I'm going to take out my tubing and take out my syringe and make sure that they're both ready to go. I'm going to hand this to them, and if they can, they would hold on to that. And then I'm going to measure out the tubing. It's been in the package, so I can work it like this to make it more pliable and flexible, or I can run it under some hot water. So I'm just going to massage it a little bit, and then I'm going to measure from the tip of the nose to the earlobe, and then from the earlobe, I'm going to measure it down to the xiphoid process. And so for this patient, we're at about 43, and I'm gonna make a tape marker right there. All right, and then I'm also going to spray some lube. Now that it is ready to go, and I have my marker in place, I'm just going to prepare them and tell them that we're going to try to do this with as least discomfort as possible, but that they will be choking and gagging. So I'm going to insert it, going with the curvature of their body, and then they're going to, at this point, they're going to start choking and gagging. I'm just going to keep going. If they can take sips of water or swallow, I'm going to ask them to do that now. If they can't, then I would put their chin more to their chest and sit them up more and follow the curvature and push it in as far as it can go. In this mannequin, it's only gonna go so far, and we're at let's see, we're at 34 right now, so it's not gonna go to this tape, but in a normal person we try to get it that distance. Now I'm going to tape it to their nose with my pants. All right, now once that's secure, I'm going to make sure that it is in the stomach and not in the lungs or where it's not supposed to be. So I'm going to grab my syringe and I'm going to pull back about 10 milliliters of air, and connected that, I'm going to just place it right there, and I'm going to listen on the stomach to make sure that I can hear the air. Okay. Oops. Okay. So as I'm listening, I'm going to push back the air, and so I hear the air. Oops. I'm going to make sure it is more connected and tight when I actually do it, and then I'm going to aspirate and just pull back a little bit of the stomach contents and put it on my litmus paper, making sure that it is below 5, and if it's below 5 then we're good and we're in the stomach. I'm going to reconnect this so that there's no backflow and things aren't coming out. Then I'm going to secure it to their gown. I'm going to make a little tape tag, and I can use a safety pin to go through the tape and then connect it to their gown, maybe on their shoulder. And then I'm going to send them up for x-ray since it's the initial insertion, and make sure that is in the correct spot indeed before we start any feeding or any medications or anything through the tube. And then I'm going to make sure that they're good and that they're comfortable. I'm going to clean up all my supplies, remove my gloves, and perform hand hygiene. Make sure the bed rail is back up and that I lower the bed back down to the lowest and locked position. I'm going to keep them in this position since they have the NG tube and I don't want them to aspirate. And then I'm going to make sure that the call light is in reach. My name is Faith, and this is my NG tube video.